Let's go over the Stimpod NMS460 pulse width settings. There are two options available, 0.1 and 0.2 milliseconds. When you switch on the Stimpod, it will default to the 0.1 millisecond setting. You can cycle through the settings by pressing the pulse width button, which is also the menu button. How do we use the different pulse width settings? The pulse width settings, along with the current setting, determines the actual charge delivered through the treating probe. A current setting of 30 milliamps with a pulse width of 0.1 milliseconds will deliver the same charge as a setting of 15 milliamps with a 0.2 milliseconds pulse width. What does this mean for you? Well, if you're treating a patient at the maximum current setting of 30 milliamps with a 0.1 millisecond pulse width, and you find that this stimulation intensity is not enough, you can change the pulse width to 0.2 milliseconds and decrease the current setting to 15 milliamps. This will deliver the same charge and the patient will experience about the same sensation. From here, you can continue to increase the current to a level that the patient can comfortably tolerate for the duration of the treatment. Most practitioners prefer to always use the Stimpod on the 0.2 millisecond pulse width setting and only revert to the 0.1 millisecond setting with patients who are particularly sensitive to the stimulation. Both of these settings can be enabled or disabled in the system menu. To do this, firstly note the dual functionality of the pulse width menu button, as well as the Hertz enter button. To access the menu, press and hold the menu button and use the wheel to select option 3, pulse width. You can enable or disable each setting by pressing enter. To save the changes you've made, use the wheel to select exit menu, press enter and accept the settings. Exit the menu by pressing the menu button again.